Hi, I'm Dr. Charlie Liu. I'm one of the GPs at Summertown Health Centre. In this video I'm going to be talking about acne management. So 90% of us will go through the experience of having acne at some point in our lives, usually during adolescence, but this can be quite a persistent condition, and up to 15% of women in particular can go through the experience of having acne in their adult life as well. And hopefully in this video I'm going to be able to give you all the information that you need to know in order to manage your acne. This video is going to cover diet and skincare, topical treatments that you can buy over the counter, oral antibiotics which you can get from your GP, and Roaccutane. So what type of acne do you have? Well, there are lots of different types of acne out there. There's comedonal acne, papulopustular acne, nodular cystic acne. There's types that are more hormonal, types that are more seborrheic, types that are more inflammatory. And I'm not going to spend a huge amount of time on this. If you're interested about the different types of acne, I'll put a link in the description below so that you can have a read. But in reality, we aren't really at the stage where we can provide individualized medicine. There's not really enough evidence out there to say that one type of treatment works better for one type of acne and a different type of treatment works better for a different type of acne. And the exception to this might be hormonal acne, which is particularly true if you've got polycystic ovarian syndrome. So this type of acne may be driven more by androgens. Androgens are the name of a group of chemicals, including testosterone. And the evidence base here isn't amazing, but there may be some additional efficacy for hormonal treatments on top of the standard acne medications, so things like spironolactone or particularly the combined oral contraceptive pill. But it is important to say that everything I'll talk about in the rest of the video is still applicable to the acne that's caused by hormonal problems and PCOS. It's just that you have the additional option of adding on a hormonal medication on top of it. So how about the location of the acne? Well, there are claims out there on the internet that if you look at where the spots are developing on your face, whether it's lower down, higher up, on the cheeks, that this will tell you what the underlying cause of the acne is. And there really isn't a lot of evidence to support this. There are some rare forms of acne that can be linked to certain lifestyle choices. For example, pomade acne is a type of acne which often occurs up here next to the hairline, and this is related to using oil-based products in the hair. But apart from that, there isn't a lot of information to be gained from where exactly your acne is appearing. However, what is important is the severity of the acne, because this will let us decide where we start in the treatment ladder. Now, we tend to classify acne into mild, moderate and severe, and the broad categories are that if you have less than 30 spots, that's counted as mild acne. If you have between 30 to 125, then that's counted as moderate acne, and if you have more than 125, then that's counted as severe acne. However, we do also take into account whether you have scarring or pigmentation, and also how badly you're affected by it. So for example, if you're suffering from a lot of psychological distress, if it is causing anxiety or depression, we do take that into account. The moderate range for acne, 30 spots to 125 spots, is obviously quite a broad range, so you may sometimes hear doctors referring to acne as mild/moderate or moderate/severe, and that just reflects being on one end of the spectrum. We do tend to have a graded approach to how we treat acne. For the milder forms of acne, we almost always go with diet, skincare and topical treatments, and I'm going to provide a lot of information on those later. And if we have moderate acne, we'll sometimes add in a booster course of some oral antibiotics to begin with, usually just a 3-month course, but we always do so in combination with diet, skincare and topical treatments. We never use oral antibiotics just by themselves. There are a couple of reasons for this. The first reason is that some of the topical treatments, for example benzoyl peroxide, will help to reduce the amount of antibiotic resistance that we get. The second reason is that oral antibiotics probably aren't that effective if just used by themselves. It's very rare for us to see a significant improvement just using a course of antibiotics but no topical treatments whatsoever. So oral antibiotics work by killing the bacteria on the surface of your skin, and therefore the bacteria don't get into the comedones and cause inflammation, but they don't do anything to affect sebum production or keratin production, and so they won't stop those whiteheads and blackheads from forming in the first place. They'll just stop them from getting inflamed, red and painful. And that's why we do always focus on the fundamentals in addition to prescribing. So let's talk about diet. So diet is always going to be one of those areas where the quality of the evidence is quite poor, and that's not for lack of trying, it's just very difficult to assess these kind of things in studies. It's quite hard to get people to accurately tell you what they've eaten day in, day out for a long period of time, for long enough to actually get any significant results. And then it's also quite difficult to tell people to change their diet and then check what happens afterwards. And in addition to that, you can never do a blinded trial. There's no such thing as a placebo version of a cabbage. But that being said, there is a little bit of evidence out there that consuming dairy and foods with a high glycemic index may worsen acne. Now, it's speculated that this is because milk contains bovine enzyme growth factors such as insulin-like growth factor and precursors to DHEA, but no one really knows for sure. And high glycemic index foods are the ones that tend to shoot your blood sugars up. So often we're talking about the carbohydrate-based foods, so things like white bread, white pasta, white rice, as well as sugary foods. And the reason for that may be related to systemic inflammation and metabolic syndrome. It's also important to get as much sleep as your body needs, as this can seriously affect the immune system and the way that your body treats inflammation. And just to be aware that alcohol, caffeine, and sleeping at the wrong time for your body clock may affect the quality of your sleep. And in addition to diet, we're also going to talk a little bit about skincare regimes. There may be some of you out there who don't really have a skincare regime at the moment. Lads in particular, I think I'm probably talking to you. I know it can be hard to even think about having a skincare regime because most of the skin products out there are marketed very aggressively towards women. There's a lot of bottles with lotus flowers on them, and you'll hear a lot of words like dewy and luminous being thrown around. But try not to let it put you off. It is really important to have a good skincare regime in order to get those spots under control. I'm afraid that washing your face once a day with a bar of soap and then drying it off with a towel that you haven't put in the laundry since 2021 just isn't going to cut it if you do want to get rid of your spots. So let's start off with skin cleansing. So as I alluded to at the beginning of the video, part of the problem with acne is that the glands, the sebaceous glands, are producing a lot of sebum, which then blocks up the pores in your skin and then create comedones, which are the precursors to spots. So when you clean the skin, you're essentially removing some of that excess sebum from the skin, and you ideally want to do this twice a day. If you're still using a soap, you may want to switch over to something else to clean your skin. Soaps are based on a slightly alkaline substance, whereas the skin has a pH of 5.5, it's slightly acidic, and so when you use a soap to clean your skin, you're altering the pH balance, and that may promote the growth of certain bacteria such as Propionibacterium acnes and Staphylococcus epidermidis, and those are two bacteria which may have a role in increasing inflammation in acne. Soap also can leave carbonate residue on the skin, which can cause some irritation and inflammation. Syndets, which are a type of detergent which you can use to wash the face, can be formulated to a slightly acidic 5.5 pH, and they're now recommended by quite a lot of the dermatology guidelines and societies. But if you buy anything that's marketed as a gentle skin cleanser or anything that's marketed as non-comedogenic and it's not too foamy or oily, then you're probably alright using that. If you wear makeup, then you probably want to wash twice, once to get rid of the makeup and then once again afterwards to get rid of any residue that the makeup might have been on top of. And that's particularly true if you're wearing heavy-duty makeup such as waterproof mascara. You may even want to double cleanse using an oil-based cleanser to start off with and get rid of most of the makeup, and then to use a gentle skin cleanser later on. And after you've cleaned, make sure when you dry your face you're using a towel that you are washing regularly, otherwise the bacteria will build up on the surface of the towel. Sun protection can be really important because some of the topical treatments that we're going to talk about later can cause photosensitivity, which basically means that you're much more prone to getting sunburn than you usually would be. So it's important to have a sun cream on board. And again, similarly to the cleanser, you don't want something that's too oily or greasy that is going to clog your pores and create spots. So there are plenty of sun creams out there that are marketed as non-comedogenic. So for anyone except the darker skinned individuals out there, I'm going to recommend that you use a sunscreen on any day that it's even a little bit sunny, just to avoid any sunburn. I'm a GP, so obviously I care about melanoma. Melanoma kills, but you are also causing damage to your appearance as well. Some of you may have seen this photo of a lorry driver who's only ever exposed to sun on one side of his face out the window, and just look at the difference between the two halves there. So you may be able to get away with it in your 20s and 30s. By your 40s and 50s, you can be really glad that you wore some sunscreen when you were younger. And just remember that UV can reflect off surfaces, particularly light surfaces. So even if you're outdoors and you're under an umbrella, if there's sun reflecting off sand, that may well cause sunburn even though you're not directly exposed. Now when you've cleansed your skin, you want to apply a moisturizer because many of the creams that we're going to use later on will be quite drying of your skin. But you also don't want to clog your pores with anything that's too heavy and oil-based. So most of the time we're looking at gel-based moisturizers. Again, if you just want to Google, you can Google the phrase non-comedogenic. I'm going to say that plenty of times in this video, and there'll be lots of options that you can buy. I'm not sponsored by any companies, so just buy the cheapest one. So how about toner? Well, toner is probably the least important part of the skincare regime if you're focusing on acne. And the reason for this is that the retinoid creams that I'm going to talk about later on do have a bit of an exfoliating action and they thin the skin anyway. So it may not be necessary to use a toner on top of this. If you do want to, just go for something gentle. Don't go for a mechanical exfoliator. Use something like a toner based on salicylic acid and don't leave it on for too long. So now we're going to move on to the topical treatments for acne. And there are 4 main types of topical treatment that we can use. There are topical antibiotics, azelaic acid, topical retinoids, and benzoyl peroxide. And in my head, I've kind of given these nicknames. So for me, the topical antibiotics are always the problematic ones. Azelaic acid is the mild one, or the all-rounder. Benzoyl peroxide is the one that leaves orange stains on everything, and the topical retinoids are the heavy hitters, or the juggernauts. And I'm going to explain a little bit about why I call them that. Now, before I start talking about the topical treatments, I do just want to set some realistic expectations here. So these creams are affecting the way that your skin cells produce keratin to proliferate, and also the way that the bacteria are growing on the skin. And these do take a little while to work. In fact, many of the spots that you develop over the next few weeks are probably in the microscopic stages already. And it's just that they're going to grow out of your skin and become more visible. And unfortunately, the creams are not going to be able to stop those from developing. So if you don't see immediate changes with these medications, do stick with it. For most of the medications that you apply to your face, we're looking at least a 4-week period to notice some improvement. And with the retinoids in particular, these can be really slow to get going. And I would say a minimum of 3 months is required to see a good improvement. But I'll show you a couple of screenshots from studies later on, and we can see that these are really effective medications. The retinoids in particular can reduce spots by something like 60, 70, 80%. So it definitely is worth sticking with them. So let's start off with the topical antibiotics, which I'm not a huge fan of. And the main reason for this is that the topical antibiotics have started to see larger and larger amounts of antibiotic resistance over the years. In some studies where they swab people's skin and then grow it in a lab to see what the bacteria are resistant to, we can see antibiotic resistance rates of up to 80%. So that means that 4 out of 5 people using topical antibiotics may not be getting any benefit whatsoever. Azelaic acid, what I call the mild one or the all-rounder, I'm actually going to put that top of my list in my perfect skincare regime. And the reason for this is that it's a very mild cream. So compared to some of the other creams like benzoyl peroxide and the topical retinoids, a lot of people can use this without getting any side effects whatsoever. When you look at dermatology guidelines, you don't usually see azelaic acid very high up in the guidelines, but I tend to put it up there just because people can use it so freely, and you can mix it with benzoyl peroxide and with retinoid creams as well. So I personally think that it's a little bit of an underdog in the world of acne management, and I'm going to recommend it for use for most people. Azelaic acid is a naturally occurring substance that's sometimes produced by microorganisms on your skin anyway, although in very tiny quantities, and it works in a couple of different ways. It is antibacterial against the organisms P. acnes and Staph epidermidis, although not in a way that is going to create antibiotic resistance. It reduces the growth of keratin and reduces the production of comedones such as whiteheads and blackheads. And it's also an antioxidant or anti-inflammatory, so it will reduce the redness that you get when those pores become inflamed. And we also happen to use azelaic acid in hyperpigmentation disorders such as melasma. So if you've suffered from darkening of the skin where your spots have been, then azelaic acid may also help to reduce that pigmentation and give your skin a more generally clear appearance. What azelaic acid doesn't do is it doesn't affect sebum production, so it's not going to make your skin less oily, which is why it is also important to clean. Now moving on to the third one, benzoyl peroxide, the one I say leaves orange stains and everything. Well, there's no doubt that benzoyl peroxide does work. It kills off bacteria, it reduces inflammation, and it reduces comedone formation. But it is quite annoying to use in general. Many of you will have had the experience of trying benzoyl peroxide in the past, and you would have applied it and then think that you've washed it all off before you then wipe your face with a towel, only to realise that you've left a tiny little bit of benzoyl peroxide up here in the corner of your forehead, and now you look down at your towel which is stained orange. And benzoyl peroxide does also have a bit more of a tendency to cause some redness and irritation of the skin, as well as drying the skin out. So we are going to add benzoyl peroxide to our perfect acne skincare regime, but just with a couple of extra conditions. You'll probably need to invest in a white towel and maybe even some white pillowcases just to prevent bleaching, and you're going to apply it and then wash it off in the shower so that you don't have any mistakes afterwards. So that brings us on to our fourth topical treatment for acne, and that's the topical retinoids, which I call the juggernauts. So these are the real heavy hitters of acne treatment. We know that they're very effective, and we also know that they work well for different types of skin. So there are studies that show that they reduce acne in people of Chinese origin and African origin. However, the problem with topical retinoids is that they just take a little while to build momentum and get going, and often we have this difficult first period, maybe lasting for a month or two, where the acne may slightly worsen worsen before it gets better. Retinoids work by changing the skin cells on a really fundamental level, so they go into the nucleus of the cells and they affect which genes are being expressed. So they are reducing keratin proliferation and stopping comedone proliferation at a really early stage in the skin cycle, as well as reducing the inflammatory response. But if you're expecting something to work on such a fundamental level, you know that it's going to take a little while for that effect to come through. And unfortunately what happens is that when you first start to apply topical retinoids, the skin starts to go through this period of increased cell turnover. So there are new skin cells being produced and the old ones are being sloughed off. If you do a little research on the internet, you may hear this referred to as the purging stage, or to dermatologists, it's probably better known as retinization. In addition to that, similarly as the benzoyl peroxide, you may find that the retinoids can cause some redness and irritation of the skin, and this can actually get a little bit worse because, as I've just mentioned, over that first month or so, the skin gets a little bit thinner, and so you increase the absorption of the retinoid that you're applying. So you may find that the redness starts to get up a little bit before it starts to get better. On the internet, you may hear this referred to as retinol burn. To dermatologists, it's probably better known as irritant contact dermatitis. It means the same thing. Your skin isn't actually getting burnt. It will just take a little while for the inflammation to die down. In really severe cases, you can apply a topical steroid such as hydrocortisone, and that you can get over the counter. So again, even though retinoids can cause some problems, they really are one of the cornerstones of acne management if you use them properly, and they can have a really good effect. So we are going to put topical retinoids in our perfect acne skincare regime, but again, just with a few little conditions and tricks so that you're not going to get the side effects and the problems, and you're hopefully just going to get the benefits. So when you pick up your retinoid cream, ideally what you want to start off by doing is just applying it to your skin for short periods of time to start off with. What I usually tell people to do is to pick a day when they're going to shower, and 15 minutes before the shower they apply the cream to their face. It's about a pea-sized amount of retinoid cream applied to the whole face, excluding the eyelids and excluding the lips, and leave it on for about 15 minutes, then go into the shower and wash it all off. Now hopefully, because you've only left it on your face for about 15 minutes for that first day, you probably won't get too much of a reaction. If you do, just don't apply it the next day or the day after that, and wait till your skin returns to its normal colour before trying again. But if you're lucky, tomorrow your skin will just look normal, and then you can try applying the retinoid cream again, maybe not for 15 minutes this time, but for 30 minutes, and just keep on building it up very gradually and allowing your skin to get used to it. But what happens if you apply the retinoid and every time you have to wait for about 3 days for that redness to go away? Well, that's still okay. The studies have shown that actually, even if you only use it once a week, you probably will still be getting some benefit from it. And once you get through that initial purging stage where your skin is still getting used to the retinoid, after a month or two, hopefully your skin will have gotten used to it and you'll be able to use it every single day and see the benefits. And once you're established on a regime, you can also double up on the azelaic acid, so you can start taking it in the morning as well as in the evening. So let's summarize there. So when you wake up in the morning, you're going to cleanse your skin and you're going to use a Syndet or a gentle skin cleanser or a non-comedogenic skin cleanser. Nothing that's oil-based, and stay away from bars of soap. Pat your skin dry, apply your azelaic acid cream. 15 or 20% is the usual concentration, and then you're going to wait for about 5 minutes to let it settle. After that, if it's a sunny day, apply a sunscreen and a moisturizer. If it's not so sunny, just apply your moisturizer. Again, you want a non-comedogenic moisturizer or sunscreen in this situation. In the evening, about 15 minutes before you shower, use the gentle skin cleanser again to clean off the face, and then apply your benzoyl peroxide and your retinoid cream. At this point, I'll mention that there is a product out there called Epiduo, which contains both benzoyl peroxide and adapalene, which is a type of retinoid, in a combination. So instead of buying 2 separate creams, you can get that one by itself. It is unfortunately only available on prescription, but most GPs will be more than happy to prescribe it just because it sits right at the top of the guidelines for most dermatological societies. And then once you've applied the benzoyl peroxide and your retinoid, leave it on for a certain amount of time. So in the first week or so, that's probably going to be 15 minutes. As you get further on into your regime, you may be able to leave it on for half an hour, or even longer, or possibly even leave it on all night. If you're going to do so, make sure that you've got white pillowcases, otherwise your pillowcases are probably going to bleach. And then once you've finished up in the shower, make sure to apply another layer of non-comedogenic moisturizer. And there it is. It's quite simple. If you follow that for a minimum of 4 weeks, you will have given your skin a very good chance of getting rid of its acne. So just a little bit about sensitive skin. If you've tried some of these topical treatments in the past and you've had to stop using them because you've gotten a lot of redness or irritation from them, then there are things that you can do to help modify this. As I've talked about already, when you first start to use the cream, just use it for a short period of time, and you don't have to start everything all in the same go. As well as that, many of the products do come in different concentrations, so you can use a lower concentration of the medication in order to just get your skin started and let it get used to it. They might not be as effective at removing the spots, but after a month or so of using these lower strength medications, you can then consider stepping up to a higher strength one. Here's an example regime of what you might consider using. So in the first week, you might just start off with skincare, diet, and adding a little bit of some azelaic acid cream, which is the mildest one, and then just trying that for a week or so and building up. After week 2, you might add in the retinoid and just put that on for 15 minutes or so. And then once you've built up a bit of a tolerance to that, you can add in some benzoyl peroxide later on, and then gradually build up the time that you leave the creams on for. Now, if you've got the moderate type of acne, we may want to start you off on a course of some oral antibiotics. The most common antibiotics we use are tetracyclines, but there are other options if you're allergic to those. But of course, because they're oral antibiotics, they do go into your system and they can cause some unwanted side effects. Probably one of the more common ones is that because they kill off some of the gut bacteria and disrupt your normal gut flora, you may get some stomach upset from this. And most of the tetracyclines are also photosensitizing, so again, they're going to increase the chance that you might get some sunburn, so make sure to apply that sunscreen regularly. But as I said at the beginning of this video, it is really important that you do all the stuff that I talked about earlier with the diet and the skincare and the topical treatments for acne. And the reason for that is that oral antibiotics are not all that effective at treating acne if just used by themselves. They're much better at treating acne if they're used in combination. We almost always use a 3-month course of oral antibiotics, and we don't generally extend this because there doesn't seem to be a lot of benefit in doing so. I can only really speculate as to why this is, but it may well have to do with antibiotic resistance building up over 3 months. And hopefully if you've been applying the skincare regime and the topical treatment, then by the 3-month period, some of those treatments will have started to kick in and you'll be able to use them effectively and your acne will stay well controlled. Now, I'm not going to talk too much about the combined oral contraceptive pill. I think that probably deserves its own full video. But lastly, I'm just going to talk quickly about Roaccutane. Now, I'm a GP, not a dermatologist, so I don't have a lot of personal experience in using it, but we do refer people on to dermatology for Roaccutane now and again. It can come with some potential side effects, and I'm going to put a link in the description below so that you can read about some of those. It is very damaging if you're a woman and you're pregnant or you breastfeed. It can be very damaging to a fetus, and that means that in the UK you will usually be monitored very closely and asked to be on 2 forms of contraception, and you'll also be asked to do a pregnancy test every month. Unless there's a good reason otherwise, for example if you're in a same-sex relationship. But it doesn't affect future fertility, so once you've come off the Roaccutane, it is safe to get pregnant as long as you leave a 1-month gap afterwards. Dryness of the skin, the inside of the nose and the eyes is a very common side effect of Roaccutane, and that can be helped with a moisturiser and eye drops. And it can also cause changes in the fat and lipid levels in the bloodstream, as well as muscle soreness and weakness after exercise. And for that reason, we do regular blood tests to check your cholesterol levels. There are reports of very rare side effects such as worsening of mood, depression, suicidal ideation, raised intracranial pressure, and inflammatory bowel disease. And in extremely rare cases, less than 1 in 10,000 people who take the tablet may actually try and commit suicide. So it's not something that we take lightly, and you're under very regular monitoring when you're on Roaccutane medication. But the good side is that it's an extremely effective medication. It works in over 90% of people who take it, and even once it's stopped, the benefit often lasts for years afterwards. Now, how about if you're pregnant or you're trying to get pregnant? Well, some of the options are no longer safe for use in pregnancy, but these ones are. So the safe options are topical azelaic acid, topical benzoyl peroxide, and topical erythromycin or oral erythromycin. Erythromycin is a type of antibiotic. Tetracyclines are contraindicated, Roaccutane is contraindicated, and topical retinoids are also contraindicated. Well, I hope that information has been really useful for you. And if you're one of my patients at Summertown Health Centre and you'd like to try the Epiduo, which is available only on prescription, then do just send me an e-consult or book in a phone call and I'll be more than happy to prescribe that for you. Leave any questions or comments below and share this video if you feel like it was useful. Thank you very much for watching.